basically we're on lisinopril, and she's in a nursing home, right?
Yeah.
Okay. And she has this swelling started today.
That's what they call it.
That's what my understanding. It started today. She's not having any trouble breathing. We did do a scope, a nasopharyngeal scope, and it looks like the arytenoid on one side is a little swollen, but her airway is wide open. And so we're doing some pressure frozen plasma, and we're doing about 4 units of that. And then sometimes these can be allergic reactions. We still go ahead and treat it just like it was an allergic reaction, although it generally doesn't help this type of angioedema. We went ahead and did H2 blockers, H1 blockers like Benadryl, and steroids, some epinephrine, and it really hasn't made a difference on the tongue swelling.
1, 2, 3, big spray.
I think he mentioned, the left nostril has some scarring, so we went through the right.
You can also hold it overhand, like that. But I personally think this one gives you a little bit more control. I'm just going to defog it here.
You want to come to the head of the bed? Why don't you come up to the head of the bed?
We're trying to look in your throat.
And just kind of help her hold her head still.
Nana, I need you to be very still. Lay your head back. You don't want to lay back?
There you go.
A little pressure. Just stay as still as possible. I'm not going to hurt you.
I know it's a little bit uncomfortable, but they need to make sure that your airway is okay.
I want to stay towards the floor or away from the septum. You can actually run it. It's a little tight there. You can go superiorly over the turbinate.
I know, Nana.
All right. It's the hardest part. You're doing fine. So I had to take the high road there.
So you went high. Okay.
Yeah. It was just very tight on the floor. Okay, you're doing fine. You're doing fine. Okay. Try and stay still. You're doing really good. And I think that looks about the same from what you were showing me.
Well, it looks like both the arytenoids are a little bit more edematous. I think from I went in here for the very first one, but the pictures.
I think that looks
about the same. But the airway is nice and open still.
Yeah, widely patent. The base of tongue, the epiglottis has a little bit of edema. Base of tongue isn't, it's not the worst. You can see into the vallecula. The fact that you can still see the vallecula is good.
Yeah.
There we go.
And she's a little stertorous because I've numbed her larynx.
Okay. So she's going to the MICU, but this needs to be rechecked.
Yeah, we
probably
2
or 3 hours.
We serially scope these patients,
okay.
Usually about Q4 to 6 hours.
Okay.
It's about a 24-hour inflammatory cycle. Coming out, you did great.
You did wonderful. Thank you so much.
All right, Nana. You did good. Thank you.
That's it.
Yeah.
H1, H2 blockers, dexamethasone, 10 milligrams IV, Q8 hours, and just watch them. Yeah.
And Alex, did we give her some epinephrine first when she got here? So we just gave her some IM epi, just, again, knowing that this is probably not allergic angioedema, but you never know.
Yeah.
And so we just go ahead and do the whole shebang.